Hello, everybody. It's Bank Holiday Monday. It's a little bit later than I planned. Had a visitor, so I do apologise. I don't know what you're doing this bank holiday. Are you out in the beautiful, glorious UK sunshine, or are you other parts of the world? I'm absolutely knackered. I'll be quite honest with you. I feel a little bit disappointed with myself. I had a plan. I'm just taking that out of the background. It didn't look right. I've had loads of plans for today. Loads of plans. Been at home, that kind of thing, and I've done nothing. Absolutely nothing. I've been in bed. I'm probably going to go back to bed for a bit. I am attending a barbecue. It's my anniversary today with my partner. It's been 3 years, so off and on. So we're having a little barbecue with family, and that'll be nice. I need my glasses. It's hurt my eyes. It's too bright. And look at my nails. Oh, it's not going well today. This isn't dirt. That's nail varnish I've picked off. I want to make it very clear. So I don't know what you're all doing today. It's perfectly okay doing nothing. I want to get that across. Don't feel guilty for doing nothing. My eyes are squinting. Fatigue is terrible. I can't quite work out if it's the medication that's making me tired or the pain that's making me tired and I need more medication. I'm not 100% sure. And this is a TENS machine that's wrapped around my neck. Currently doing its little business. I was looking at hysterectomy. It's, less than 28 days to go. And I was looking at what that actually entails. What bits am I going to have removed? I've got my pre-op on Tuesday. So a pre-op is what they do before the operation. I am squinting. I do need glasses. I'm like that. The pre-op is what they do like a couple of weeks before your operation. No longer than 3 months before, and it's just to basically check you're healthy enough for your operation. So they'll take statistics, i.e. they'll tell me I'm a bit fat. Then they'll sort of ask what medication you're taking, make sure you're not taking supplements. So there's things that thin your blood that you shouldn't be taking. So make sure before an operation you're not taking things like garlic, supplements. Just be very careful what it is you are taking, because they can cancel your op if you are. Things that can affect the, like I say, thinness of your blood. I take things like iron occasionally. I've been taking this thing for toxins, and vitamin D and magnesium I try and take because of the fibromyalgia. So you just got to be careful with the supplements. So this pre-op, the check over to make sure you're okay. Have I had any tattoos in the last 3 months? Honest, no, I haven't. I don't think I have actually. But they do check things like that. Piercings, no. But obviously I'd have to take all my piercings out, which is a bit frustrating because I don't want to, because I've just had to put that one back in again. I put like a thinner one in and it started to heal up within 12. Look at my eyes. I'm like, I wasn't drinking last night, I swear. I've got the look of someone who's alcoholic, who just woke up and going, I've had to put a thicker one in, so I've had to push it all the way through. And this just shows how much pain I could handle that. That's fine. Not a problem at all. No, I could stick something right through my nose. I'm used to pain because I have endo. I think I'm slurring a little bit as well. That could be the medication. This is what it does to you. This is living example of what it is to be a grown woman living with endometriosis. I'm in my 90 because I can't be asked to get changed. Why bother? Like I say, I'm going to have a lie down later. Might have a little nap. I need a nap. I need a nana nap. Needed one all day long. Just tired. Very tired. Just come off a period. So my body's healing. Literally just stopped my period. I have it very heavy for about 4 days, and then it just stops. Just goes, stop. That's what it does. So I've only got one left. Woo! So surgery for hysterectomy, it's goes in sort of radical grades. So you can have something very extreme, which is called a radical hysterectomy, and that's where they take not just your ovaries and your uterus, but they take your tubes, they'll take your cervix, they'll take everything. That's not something that I've been offered. I'm not having a radical hysterectomy. What I'm having is a hysterectomy with a bilateral oophorectomy. So I'm having a hysterectomy with a removal of the uterus. That's what they talk about, the removal of the uterus. And the oophorectomy is the removal of the ovaries. Now I'm having just one ovary removed because I've already got another ovary removed. Yeah, it's not just me, Kelly, is it? Mine's non-stop, like Niagara Falls, but not as pleasant. And then it just stops, like it's. But then my body has to heal from, like yours will do. It's had like a massive stress. The inflammation, I think, is still there. I get a lot of pain deep inside. That's why I've got my TENS machine on. So I'm having not a radical hysterectomy. That will be often offered if you've had things like cancer. If there's a risk of cancer, because they don't want it spreading, so they will take everything. That's not something they necessarily talk about when it's hysterectomy for endometriosis or adenomyosis. So they're going to take my uterus and they're going to take my ovary, and that's what they would normally do with a hysterectomy for endo. I guess they keep the cervix. I suppose I'd like to keep some structure in there as a preventative measure for a prolapse, because one of the higher risks of post-hysterectomy is a prolapse of the bladder and a prolapse of the bowel through the sort of vaginal wall. Vaginal. My mouth's way too tired to say vaginal. Vaginal wall. So one of the risks is a prolapse. But that's just, I suppose, knowing the risks. Laparoscopy is the technique that's preferred to be used when doing the hysterectomy. So that's where they would do the 3 parts. So there's one will be the camera, they fill up your belly with air, they go inside, like a laparoscopy, where they're checking for endometriosis and for when they're treating endometriosis. That's the ideal situation. However, if it's too complex and too complicated, that's where they'll cut you open, and that's called a laparotomy. Laparoscopy? Yeah, laparotomy. And that's a bigger scar, and that's where they have to go in and obviously need more space. But it should be a laparoscopy. All goes to plan. Laparoscopy is just as the same as those sorts of operations that we've had before, because women with endo tend to have lots of operations. As you can see, I am so tired. It's terrible. Let me just read that message, Kelly. I've had endo. I'm 41 now. I could just hear the gasp of like shock when I said that. Yeah, I'm 41 now, and I've been diagnosed since I was 27, but I had it before, but I didn't know what it was. So I've most definitely had it since teenage years, but you don't know what it is. So I was on the pill, which masked symptoms when you're on the pills. I just thought heavy period, discomfort was the normal scenario for women, But it was after I had my children, which didn't go easy for me, but that's another story entirely. After I had my children, I didn't go on the pill or anything, and that's when the endometriosis hit me like a steam train. And I think it was because I was going through a huge period of stress. I'm having to concentrate really hard on talking. I do apologise. Cover one eye at a time because I'm so tired. That's having a little sleep, that side. That's when the symptoms really started. So from the age of 27, so that's what, 27, 14 years. I'm not sure what stage you would classify me as. I would say I'm more like a stage 1, I would say, at the moment. I think staging is a really good way of surgeons to measure what parts of the anatomy have been infiltrated by endometriosis, because there needs to be some method of measurement, and that's been something that's been in place since the 1970s, this sort of staging. However, I do believe staging can be misleading in representation of symptoms. So the level of pain you may feel, or the discomfort, or the difficulty you have, I think staging can be misleading for some. Like, so if you've stage 1 or stage 2, I mean, I'm talking about myself, I think it can be misleading because it doesn't represent, and that's a knowledge that should be understood throughout with medical professionals as well, but it is a really good way of understanding where you are affected, because your anatomy inside when you have endometriosis isn't always, but can be really unrecognisable. I've heard about ovaries being found up, by the diaphragm and, by scarring. So it is, like I say, a good way of measuring. And, it can be very shocking, I'm sure. You've had a laparoscopy 2 years ago and suddenly found out you were stage 4. I mean, that's pretty shocking, isn't it? That must have been, wow, quite devastating disease, especially because it can be degenerative. So it wasn't always that way. It's got worse as time's gone on. And as it's been untreated, it's just got worse and worse. And what they can do, obviously, during laparoscopy is remove the endometriosis and those adhesions. Adhesions, for those who don't know, is, and I didn't know until I was thinking, why do they keep saying adhesions? Is scar tissue. So it's rather like, Spider-Man goes and it flashed. Magic. In his shoes, like a web. It's a bit like that web, but it's not stretchy. It's, like the skin between your fingers. It doesn't stretch any further. And scar tissue can form inside your pelvis, and your organs can be stuck together. Your bowel can most certainly be impacted with endometriosis, probably way more than any of us ever realise. I don't know if you get bad bowels or not. I know when I'm on my period, my bowel just stabs. It's just terrible. I just go, ooh, and have to hold on to things as I feel like I'm ripping on the inside. Now, I could tell you a story about the sigmoidoscopy that I had once. Whoa, it was terrible. I felt like I was being killed. I was very upset. Due to my colon, I feel well after, but at a time I was sleeping the hour before. I can imagine what you're saying there, Kelly, in regards to, when you've got stage 4, that it was affecting your colon, as in it did. The scar tissue, glues your anatomy together. And there's a misunderstanding as well that it doesn't have to be a female gynecology that's involved. So when we say endometriosis, we're not talking about, I don't mean just the ovaries and the uterus and, female gynecology, it affects the whole anatomy, or can do. So this is your diaphragm, your colon, your kidneys, and these anatomies can be masculine. And I think somehow when you talk about these anatomies, there's a level of seriousness, like, oh, bloody hell, it affects your lungs, whoa. Yeah, actually, the gynecological part of things is just as severe, and your bladder and your bowel and your uterus. It's, if a man had a similar disease that, caused chronic pain of his penis, I think there would be a national outcry and there would certainly be a cure. But because it's a female uterus, let's be fair, it's been downgraded as just something you have to deal with. I'm sure if a man every month got excruciating pain of the penis, I don't think he'd be laughing. And I don't think there would be so little information and understanding. I think it would be like way more prevalent on everybody's agenda. But that's my opinion, and I'm not alone in my opinion, am I? So yes, the staging can be a little misleading, but not necessarily. It's just the understanding of it, really. So I've been reading a little bit more about hysterectomy. I do need to ask the question just to double check. I'm not sure whether I'm keeping my cervix or not. I don't know. I think I am. Does it matter? I don't know. Do I need it? I don't know. Anne-Marie, I'm just having a read of your message. I'm squinting because I can't see properly. Oh, look like a right pisshead. I had stage 4 and I wasn't diagnosed right away. It was 8 years to diagnose it. Well, 8 years to diagnose it sounds about right. You can take up to, on average, 7 years for diagnosis. How ridiculous is that? And they still won't give me anything. Oh, dear. Although they tell me how painful they know it is. Due for pain is a way to get help. Oh, bless you. Pain management. I take a variety of things for pain management. I think there's a 3-prong approach to pain management, Anna. Okay? So, first one is orthodox medicine. The second one is non-orthodox. So orthodox is the stuff you get from your GP, pain meds. Non-orthodox medicine is the things that you don't get from your GP, such as complementary therapies. And I would also consider things like, I don't know if you've got a TENS machine. So if you don't have a TENS machine, please have a look for a TENS machine. It won't fix it, as in like it won't cure it, it's nothing like that, but it does take the edge off, and it's like having a toolbox, okay, Anna, of everything that you've got to throw at the pain. So it's like having a toolbox. So imagine a toolbox. You don't have to buy a toolbox. That's just my way of describing it. And you find everything you can that helps with the pain. So heat is really helpful. So hot water bottles, try not to burn yourself, please. Wheat bags, because they've got the lavender and things in there. They're really good. Heat can be really helpful because it disrupts the pain signals. Those nerves that send in the pain back and forward, they get disrupted by the heat. Similarly, with a TENS machine, they send electromagnetic messages to each other. So you get electrocuted. I don't know if you want to see my No, you don't want to see my TENS machine. It's done something funny. I'll just say, I'm not going to show you my pants. I was going to show you my pants, but it told me not to. So I've got a TENS machine on at the moment. And Kelly agrees with me. They're not expensive. I've bought this TENS machine, was like £6.99. Don't have to pay a lot of money. Just 2 pads. You put them on either side of the pain. So I've got my scar tissue going across like that, just above my pubes. I said pubes. And then you stick them on. Medical marijuana. Okay. So if you've tried a TENS machine and you try heat and hot baths You can try CBD, which is the non-THC variant of marijuana, okay? Or you can try medical marijuana. I don't know, whereabouts do you live? Whereabouts are you in America? Is it something you can get your hands on, or are you in the UK? It does make a difference where you're receiving your treatment. If you're in America, it is sort of, we have the NHS here in the UK, which is totally different. I do sort of have sympathy for you guys in America, I really do. It's totally different. I would recommend a TENS machine. If you do try that one, if you try other things, have you tried BU? BEYOU. It's a product that you can stick on, and it's like herbal. It's like, what's that stuff you rub on your chest and when you've got a cold? Vicks Vapor Rub. It's a bit like a Vicks Vapor Rub type of smell that goes across. I'm sorry, BU, that I couldn't describe it better. I'm tired. That is really helpful. Don't. If you haven't tried it, I would have a go. They're about $5.99 for 4, 5, 6 of the strips, and they are really useful. I really would try it. Medical marijuana. What I would say, I'd say give it a go. I'd say that most things in life, you've got to suck it and see. But don't suck the marijuana. I'd probably, or eat it. Or what I have heard, joking apart, is that under the tongue, if you put something like a tincture or something that you can absorb, if you put it under your tongue, it goes straight into your bloodstream. If you ingest it through your mouth, it needs to be ingested into your stomach. So that takes longer. Lotions could work. I've heard, we were talking to somebody else about putting it in your belly button, in your umbilicus, because apparently that goes straight into your core. So I'd have a research of that, the best ways to ingest it. So whatever you do, whatever you choose, I would suggest you research. Do your own research. So if you're considering it, how easy is it to get hold of? Is it something you could try? Where would you get it from? If you don't get it from a medical stream, if you get it from somebody who's just selling it, then I'd just double check to make sure. And a lot of suppliers are now providing it in for medicinal use. They understand that it's a massive demand, a huge demand, and they will have it in any which way you want it. So if that's what you want to try, then I would definitely try it. I think certainly from a muscular point of view, it can be very relaxing from a muscle point of view. So if you're, for example, if you've got a bad back and your back's paining, I think you can, and it was spasming, you could take a bit of that, and I think it would release your back pain. I don't know how efficient it is for endometriosis pain. Personally, I feel an anti-inflammatory would help. And, excuse me, whilst I rub my eyeballs. Anti-inflammatory would help, so you could try an anti-inflammatory diet. So that's things like tomatoes and red foods. So you could have a really intense juice shake thing. There's so much you can try, and that is, I'm shifting it around because I can't keep still. There's so much you can try that's part of your toolbox. So you can get really creative. So you can combine lots of things together, and the overall benefit can be significant. So even though that heat bag didn't really help, it might help a bit. And then when you mix it with other things, you get a really effective pain management. However, no matter what it is you do to help with pain, it isn't going to fix it. And that's the problem. I would look at your immune system to make sure your immune system is running efficiently. I have fibromyalgia too, and migraines, so I want to high five you. So get your hand to the screen, Anna, and let's high five. Ready? Whoa, high five to the fibro. I would look at your immune system, Anna. I would have a look, and I'd have a look at maybe ways of boosting your immune system. Vitamin C, zinc, magnesium, these are all helpful. Either take them ideally within food or as a supplement. And to see if you get any benefit, if you try that for a few weeks and see if there's any improvement. Inefficient immune system could be what's causing a lot of the symptoms you're talking about and the problems. So perhaps that's the way forward. But ultimately, with endometriosis, no matter what pain management you throw at it, it's still going to be there. And that's where the only option we have is surgical. A removal of the endometriosis of the disease is unfortunately the only hope of a cure, if you like. Okay, if you got any questions, Annie, you're more than welcome to private message me. I'm getting really tired now, so I'm gonna click off in a minute because I don't think I can keep my eyes open any longer, and I'm just going falling asleep. No energy, as you can see. This is no energy. This is what it's like. I'm absolutely useless. I had so much needed to do. My house is a mess. I wanted to, I couldn't even pluck my eyebrows. I'm so tired. So any questions, I will clock in, during the week. Anything you'd like me, to talk about. If you think there's anything you're interested in, just give me a shout. Thank you for listening to me warbling on. I'll be posting it to YouTube to our YouTube channel. When I wake up from my sleep, I am so tired. Much love to you all. Thank you for listening. Big kiss. Bye, guys.